Hello friends, welcome back to my YouTube channel. In this video, I want to tell about the case, Jacques Roy, Medicare Mayhem. Jacques Roy was a doctor and owner of Medistat Group Associates, a home healthcare agency based in DeSoto, Texas. The agency provided home healthcare services to Medicare beneficiaries, Texas. The agency provided home healthcare services for elderly and disabled individuals in the United States. Jacques Roy, also known as Dr. Jacques Roy, was a physician who became known for his involvement in a Medicare fraud scheme. He was the central figure in a case dubbed Medicare Mayhem, or the Dallas Home Health Fraud. Dr. Jacques Roy owned and operated Medistat Group Associates, a home health care company based in Texas. Between 2006 and 2011, Roy and his co-conspirators orchestrated a large-scale Medicare fraud scheme, billing Medicare for unnecessary and fraudulent home health services. They recruited and paid patient recruiters, who in turn found Medicare beneficiaries willing to participate in the scheme. Under Roy's direction, Medistat billed Medicare for services that were either medically unnecessary or were never provided. The company fabricated medical records, diagnoses, and patient assessments to make it appear as though the services were legitimate. The fraudulent claims submitted to Medicare totaled approximately $375 million, making it one of the largest Medicare fraud cases in U.S. history. The case of Jacques Roy highlighted the prevalence of Medicare fraud in the United States, and the significant financial impact it has on the healthcare system. It also served as a reminder of the ongoing efforts by law enforcement agencies to combat healthcare fraud and protect government programs like Medicare. Scheme operation. From 2006 to 2011, Jacques Roy operated a home health agency called Medistat Group Associates. He conspired with other individuals to submit fraudulent claims to Medicare for unnecessary home health services. False claims. Roy and his co-conspirators submitted approximately $375 million in fraudulent claims to Medicare. These claims were for home health services that were either medically unnecessary or were never provided at all. Recruitment of beneficiaries. Roy and his team recruited Medicare beneficiaries, often through patient recruiters, who would falsely certify that they needed home health services. They would then bill Medicare for these services, even if they were not required. False documentation. To support the fraudulent claims, Roy and his co-conspirators fabricated medical records and other documentation to make it appear as if the services were legitimate and necessary. Kickbacks and laundering. Roy paid kickbacks to patient recruiters and other individuals involved in the scheme. He also used shell companies and other means to launder the proceeds from the fraudulent claims. The fraud scheme. From 2006 to 2011, Jacques Roy and his associates orchestrated a massive Medicare fraud scheme. They submitted fraudulent claims to Medicare for services that were either medically unnecessary or never provided. The scheme involved recruiting and paying patient recruiters, who in turn found Medicare beneficiaries willing to participate in the fraud. False documentation. Roy and his co-conspirators fabricated medical records, including physicians' orders, certifications, and plans of care, to make it appear as if the services were necessary and provided. They also billed Medicare for home healthcare services that were often not rendered, or were provided to patients who were not eligible for such services. Excessive billing. The fraudulent claims submitted by Roy and his associates amounted to hundreds of millions of dollars. They billed Medicare for services like home healthcare visits, skilled nursing services, and physical therapy that were either not required or not provided. The excessive billing allowed them to receive substantial reimbursements from Medicare. Indictment and conviction. In 2012, Jacques Roy was indicted on charges including conspiracy to commit healthcare fraud, and making false statements related to healthcare matters. After a lengthy trial, in April 2016, Roy was found guilty on all charges. In 2012, Dr. Jacques Roy was arrested and charged with various offenses, including conspiracy to commit healthcare fraud, and obstructing justice. In 2016, he was convicted on multiple counts, including conspiracy to commit healthcare fraud and healthcare fraud. Roy was sentenced to 35 years in federal prison and ordered to pay restitution of $268 million to the Medicare program. The Medicare Mayhem case highlighted the vulnerability of the Medicare system to fraudulent schemes. It also demonstrated the efforts of law enforcement agencies to combat healthcare fraud and protect taxpayer-funded programs like Medicare. The case led to increased scrutiny and implementation of stricter measures to prevent and detect Medicare fraud. The case led to increased scrutiny and implementation of stricter measures Medicare fraud to prevent and detect. The case led to investigate and prosecute healthcare fraud cases. Overall, the Jacques Roy Medicare fraud case serves as a notable example of the consequences individuals and organizations can face when engaging in large-scale healthcare fraud schemes. Subscribe to the channel for daily and new information-related financial fraud with interesting facts case in history. Share the video as much as you can and like the video. Thank you for watching.